Welcome back to Squawk Box. SPACs starting to rebound. The CNBC SPAC post-deal index higher over the past month. That is speculation creeping back into the market. Cano Health going public today via SPAC after merging with Barry Sternlicht's Jaws Acquisition Corp. Joining us right now for a first on CNBC interview is Dr. Marlo Hernandez, founder and CEO and chairman of Cano Health. Good morning to you. This is going to be day one post-deal. The stock thus far has traded all over the map, as you've watched over the past month and a half now, if not more. How do you think investors should look at this company no longer as a SPAC, but as Cano?
Well, good morning, and thanks for having me back. Well, certainly very excited. Today is a very special day for us. I think that investors looking at us need to look at the fundamentals, our growth track record, our clinical outcomes, our 10-year profitability. And I can guarantee you, when you take a look, you're going to like what you see.
In terms of multiples, in terms of comparables, how would you, I mean, this is your opportunity to explain to the investor class, if you will, how to think about that?
Yeah, well, the way I see it is that we're succeeding first and foremost because our patients are getting better care, because we're solving a national problem of this low quality, cost, ineffective, misaligned type care. And when you take a look at us and you look at our billion plus in revenue, you look at our CAGR that has effectively been doubling the size of the company over the last 4 years. You look at the fact that we're growing 70% this year, that we have already increased guidance, then, I would let your viewers, investors decide, whether we're appropriately priced.
But in terms of comparables, because others want to look at other publicly traded companies, is Oak Street Health on your list? I'm just trying to look out and say to myself, okay, here's Cano over here, here's so-and-so over here. They're trading at this multiple. Sure. Therefore, Cano should be trading at a similar multiple. There's One Life Healthcare out there. They're both trading, by the way, at significantly higher multiples, at least currently, depending on how you think about it, than where you are.
Yeah, no, I would agree with you in that, One Life, One Medical, Oak Street, and, others would be comparable companies. We certainly do a lot of the same thing, but what differentiates us is that while we operate medical centers, we operate more than 70 medical centers, we manage hundreds of physicians, we treat hundreds of thousands of patients. This year alone, we're getting to 2 million patient visits. We also grow in 3 distinct ways. We grow by building, buy, and managing. So our care model is supercharged by this core competency, but you're absolutely right. Those would be the right comparables to look at.
What do you think is singularly the biggest risk to your business right now?
Well, I think we've done a really good job of managing risk. We've overcome, hurricanes. We've helped beat a pandemic. And I think just in the industry, the sector, the burgeoning sector of value-based healthcare, which is the present, the future, the country needs it. It's just time. It's time to get the maturity in the different markets, the penetration of this kind of model, more networks and more hospitals participating. And we're seeing that, across the country.
In terms of risk, though, how should we think about Washington, about the models changing in terms of how some of these payments get made over time?
Yeah, well, what I would say there is that Medicare, government programs like Medicaid at the state, level, these are incredibly popular and important programs. In the case of Medicare, it's an entitlement program. We've all been paying into it our whole life. If anything, what Washington is thinking about is expanding it, lowering the retiring age, expanding the benefits. And because of the success of models like Medicare Advantage of companies like ours, they're looking to push more of the membership, the Medicare beneficiary, to companies with a proven track record of improving outcomes while controlling cost.
Shepard Smith here. Thanks for watching CNBC on YouTube.